afternoon, everyone. Good afternoon, good morning, good night, depending where you are. We are really happy that you are here. My name is Dr. Kimmery Bug, and I am with Reaching Our Sisters Everywhere. And we are so happy to be a part of the MHLIC team that has done phenomenal work, as you all know. In so many different areas. This presentation today, we are the I in BIPOC, Community Design Full Doula Spectrum Care, is one of the equity series, and we are so excited that Vanessa Lovejoy Guron is here with us. I am going to read you a bit of her bio and then let her have it because she has a lot to share with us. Vanessa's passion for birth work through an intersectional lens began percolating rather, after the profound connection she and her wife made having a doula attend their births. She hopes that her work as an Indigenous full spectrum doula, lactation counselor, and perinatal health educator has helped dismantle these systematic barriers. As a BirthKeeper program manager, she supports a team of incredible perinatal health professionals providing culturally relevant care. She believes that healthy communities begin and end with how we care for our birthing people, that honoring body sovereignty and our roots lead to improved health outcomes. So growing our babies, birthing our babies, nursing our babies, and caring for our families in community is ceremony. And with that, I would like to turn it over to Vanessa.
Thank you so much. I'm very honored to be here. Is the volume okay? Okay, great. I can't believe I actually wrote that bio. I was like, wow, who is this person? That person is me. Go ahead to the next slide, please. Yes, so healthy communities begin and end with how we care for our birthing people. Today, go ahead, next slide. Today, I'm going to talk about our mission and what is an Indigenous birth keeper, what does full spectrum mean, our values, what our support looks like, our program outcomes, and why community designed, in case that's a new term. And then I'm going to go into a little bit about Washington State maternal mortality rates and Indigenous community action, if those folks who are interested in going to the small group discussion. And I have some homework for you, a little preview, and just a list of additional programs at Hummingbird. Next slide, please. I love this quote. And so one of the families we served, she said, aunties are the game changers. This is not only life-changing, it's life-saving. And we were just talking about aunties and superpowers, because we all chip in the best way, and we're not all mothers. And so I just wanted to highlight that. So we launched in 2019. And, you know, Hummingbird is the first and only Indigenous agency in King, Pierce, and Snohomish County. This is in Washington State. And we exclusively serve Native American, Alaska Native, Native Hawaiian, and Pacific Islander pregnant people and their families from 0 to 3. Next slide. So what is an Indigenous birth keeper? The simplest way is we're an auntie, we're a relative. We provide continuous and unconditional mental, physical, emotional, and spiritual support during the perinatal period. Next slide. And full spectrum, what does that mean? So we care for folks across the reproductive spectrum. So prenatal, birth, postpartum care, lactation, folks experiencing pregnancy loss, considering abortion, needing abortion care support, needing family planning. We hope that families in our care feel loved and seen as their whole selves. There's a story actually. Go back to the slide previous. Okay, okay. So this picture down here is with one of our birth keepers and the little baby there she's holding. So there's a Dene tradition that whoever makes the baby have their first laugh, we have to throw a laughing ceremony. It's basically a big party. And as an Indigenous BirthKeeper program, of course we had to throw the party. And so this is one of our birth keepers with him. And, of course he's laughing as she's holding him. And it's really special that while, none of my team are Dene, we actually have Dene staff at Hummingbird and other Dene relatives in our caseload. We were able to put this party together and serve this family in a very special way that she wouldn't have gotten anywhere else. Next slide. So these are our values. One time I did a talk and we listed off all of these bullet points. And afterwards, a man came up. He was also working for a health equity, maternal health. And he had tears in his eyes. He said, no one's ever told me that I'm the perfect parent for my baby. And that's why it's the first one, right? Like we need to be told that because we're told otherwise out there. And so that is a foundation of what we do. So we center Indigenous people in our work and the importance of providing culturally relevant care, like that laughing ceremony. Go ahead, next slide, please. So I often get requests to do these kinds of presentations as far as, any tips on how to serve Indigenous people, in a maternal health setting. And I'm going to go ahead and tell you about what our prenatal home visits look like, what our labor support looks like, lactation, postpartum, and abortion care, pregnancy loss. And really, the bar should be this for everyone, right? And I think the main difference in our what our support looks like is the frequency of our visits. And so consider that as far as, if you're considering starting your own program. And so for prenatal home visits, they could be an hour and a half long, and people can have a home visit every other week, whether they enroll in our program at 14 weeks prenatal or 30 something weeks prenatally. Towards that last month, towards your estimated due date, most people want to see their birth keeper once a week, just as it gets closer. The wonderful thing about what we do is it's tailored to what you want. Some people don't need every other week visits. It could be once a month, every 3 weeks. So we and I'll go into our community designed aspect in a little bit, but we can do that. It's what people need. Go ahead and next slide, please. So I think also compared to like conventional doula support, we want folks to call us when they're ready for us to come, right? We're non-clinical support, but we're there way before we go to the hospital. If it's a home birth, we're there way before the midwife comes. And I don't want families to think, oh, it's too early. I don't want to, waste their time, or I don't want them to be with us too long. We want them to call us when they're ready. And maybe it's just about bringing them a traditional soup or bringing them some teas. It could just be, sitting with them and having set support so they can go back to sleep, right? And we come back in an hour or so. And so that's important for us to honor. They know that we love them like aunties, and we'll support them through their entire labor and birth. Next slide, please. So a postpartum home visit, they can be up to 4 hours long every week. As many of us might know, that's when the real work happens, is after baby is born. Lactation is very important to us, so we often come visit them the day after baby is born, between day 3 to day 5 post-birth. That's when our colostrum begins to transition to mature milk, and we want to be there for all of that. A lot of times we just do very mundane things, like we help tidy up the kitchen, we help folding laundry. I believe the best home visit looks like this. I walk in and she's sitting on the sofa with her baby, and I look at her and I think, well, she looks incredibly relaxed. And I ask her, did you just nurse your baby? And she says yes, because oftentimes that's how people look. They look very relaxed after they nurse their baby, because oxytocin helps our milk flow. And we might sit there for an hour and visit, and just so they have someone to talk to. They can go take a shower, they can go take a nap, and we'll wake them when baby's ready to nurse. Next slide, please. So we bring all the teas, all the broth, traditional foods. It's important to stay hydrated and nourished. Of course, we practice different nursing positions. Lots of times we need to talk to family members on how to center the dyad between nursing parent and infant. The other family members will bond with the baby just fine. The baby learns the other family members are caring for them by how the nursing parent treats them. And that's where the bonding occurs. And so how parents need support around the clock, help with additional pillows, help position baby. Oftentimes partners don't know how to support that. And I was just at a lactation visit, and I was showing her how to just do a light massage as baby is nursing. She was having some trouble with plug ducts. And I was showing her light massage, because some people don't do light. We don't want to inflame the tissue, nice and light. And I looked over and I could see her husband and the look in his eye of how much he wanted to help, and he just didn't know how. And so I get, come over here, see what I'm doing, and it's very hands-on. So I got his hands, and he said, oh, you can see so much at this position. And she said, wow, it's like I have another set of hands. It's like, yes, it's exactly what this is all about. And it's just a true joy to foster that connection. Because oxytocin helps our milk flow. Next slide, please. And so we also support pregnancy loss, choice counseling, abortion, and family planning support. We also, I was able to get additional funding that we can support abortion financial support. So for people who live in the areas of the state or neighboring states where abortion care is either illegal or very inaccessible, we have funds to fly you over here or fly you to the nearest state where you can get that care. Travel, lodging, loss of wages, childcare, all of those things. and the only requirement is to be Native, Alaska Native, Pacific Islander, and Native Hawaiian. I'm going to have my website at the end, and so please send them our way. We want to help them. This is a quote. So we're a reproductive justice organization. We support families in the right to have children, to not have children, and to raise our children in safe and healthy environments. This is a quote from a relative who received abortion care from us. I want you to know how much your care and support in this time has made a real difference. I feel more capable of caring for myself and of healing, and that is such a gift at a time when everything feels so tender. Yeah, and I could see her face. I know this person. And I'll let you know how many people we've served in the last 5 years, and it's amazing how I read a quote at one of our surveys, and I know exactly who they are. I may not remember their babies' names, but I remember their stories. Next slide. So here are some program outcomes. So September 2019 to January, we've served 181 families. And I feel like our rates are slightly better than state and national rates. And this is a lovely quote. I felt extremely supported, and she's like a sister and a friend. And we call the people we serve, we call them our relatives because they are. I have people that I look at them and she looks like my cousin. And so it's really hard to see them any other way. At one time I was serving a relative at the hospital, and the doctor came in and he said, "Oh, are you a relative?" And I wanted to cry, and I was like, "Well, yes, of course. I'm also the doula." And so families generally choose to work with us postpartum between three months to 5.5 months. Now it's closer to 3 to 4 months. I'll tell you really briefly about a home visiting program that we started because of, at capacity, we need to serve more people. We got funding to expand lots of new programs. Excuse me, next slide, please. And this is our most important outcome. And this is another quote. Working with someone I can culturally identify with is almost indescribable. I don't have to explain who I am, nor prove that my experiences are real and honest. I don't have to wear a mask or have to code switch for the sake of my provider understanding my experiences. Having an Indigenous doula allows me to engage in my care without feeling like I have to advocate for my needs, to the point of missing out on my care. And so this is, like I said, our most important outcome. 98% of our relatives felt better off and satisfied with our services. That is what's important to us. Yes, those other rates are important. Lactation rates, cesarean rates, those are all important, but this is what we care about. Next slide, please. So we're very deliberate with the rates we commit as funding deliverables. We don't commit to rates like birth outcomes or lactation, but we do record these rates. What's most important, like I said, is how many families we serve and if they feel better off once we transition them. So these rates inevitably improve maternal health outcomes, not the other way around. And we care for each other as relatives. We're directly held accountable to the communities we serve because we belong to the communities we serve. If something is going on with one of our relatives, I get a call from grandma, right? I get a call from auntie, and they say, what's going on, whatever the issue is. So yes, some of them have my personal number, right? So they know who to call. They know if there's someone who needs help, they know to call me. Next slide, please. So here's the part where it's I kind of told you a little bit about what we do, and now I'm going to tell you why we do what we do. This is our state's maternal mortality rates. And so as you can see, American Indian, Alaska Native people are 8.5 times greater pregnancy-associated, at risk for pregnancy-associated death than the corresponding rate for white pregnant people. And similarly, risk for Black people and Native Hawaiian Pacific Islander people was more than 2.5 times the corresponding rate to white pregnant people. A third of the deaths occurred within 42 days post-birth. And so that is why, as I said earlier, our postpartum visits, we're there from day one. We come see you every week. We check on you. If you had some preeclampsia risks or high blood pressure risks, we ask, are you taking your meds? You know, when was the last time you needed to talk to your clinic because your rates were a little bit higher? We know that the stakes are higher for our community. We actually recently we had our first infant death. It was right at birth, and I can't tell you how quickly we mobilized to serve this family. Someone made a star quilt. Someone made a ribbon shirt for him for burial. We called another community member to come and take photos in the hospital room. All this happened within an hour of finding out. And that's one of the benefits of having a program like ours. We know who to call. While Seattle is a big area, King County is one of the biggest counties in Washington State. It's a very tight-knit urban community. And 80% of the deaths were preventable. Next slide, please. So here's a little preview for those who are interested in joining our small group discussion. I would love for folks to highlight any Indigenous organization in your area to highlight their birth equity work. And then also, what are your state's maternal mortality rates? And if you're not already part of your maternal mortality panel, or what is the selection process? How can you apply? What is the term? Time commitment. These are important things to consider when doing your maternal health. And many of you might already know these things, but if you don't, this is a good thing to consider. Next slide. Oh, other way. One more. There we go. So wraparound care, like I said, we were able to expand our services because people wanted to stay with us for longer than 3 months postpartum, and our capacity just could no longer support that. We started a home visiting and family connections program, and like our program, it is also community designed. We have our guaranteed income program, the Nest, which is a 3-year pilot, serving 150 pregnant people who receive $1,250 a month until their child is 3. We actually just did our final selection. So now we have 150 pregnant people receiving this care. And then we have evaluation, we call data sovereignty. And along with evaluation, we have a storytelling program and cultural and community engagement. So I think one of the most important things that I want to make sure, I leave with you is that the way we care for our relatives, it is a very high bar, right? Like I said, we're all a part of the community, the communities we serve. and we're accountable to each other, and we're accountable to them. And the thing about serving our own people is that we are serving our cousins, we're serving our aunties, their children call us auntie. Sometimes if they're young enough, they call me auntie. And so what Indigenous doula care versus a conventional doula care, you know, we're trained to advocate. And there are times where we have to be a little bit more insistent on why is this happening? We will speak for our families if they are unable to speak. You know, in the situation where literally compliance is survival, a lot of folks don't feel comfortable to speak, and we will speak for them. And that just means, you know, one of the things I tell my team is do whatever you can, but don't get kicked out of the room, right? And you know, we push because it's important and the stakes are so high. You saw our rates, we're dying, and it is a matter of life and death. It's not just life-changing, it is life-saving. So the stakes are really high for us. And I tear up because I think about all of the stories we hold. I think about how worried I am by my team because of this vicarious trauma, right? All of the stories they hold. And it's not all trauma. There's so many celebrations, like that laughing ceremony. They gave us gifts. See, these earrings are gifted by one of our relatives. It's a pre-colonial symbol from the Philippines of fertility and motherhood. It's special to be a part of this. And yeah, imagine what that would feel like if you were served this way. Okay, what time is it? I think we have time. If you're thinking about starting a program like this, I want to hear your questions. I have more stories to share if you just want more stories. Yeah, this is a good time for that.
So if you have questions, if you would put them in the chat, then Allison and I will look at those and bring them to Vanessa. And Vanessa, yeah, tell us some more stories, okay? You know, we always want people to leave with something in their head and something in their heart. And storytelling is definitely a way that we like to get to having that an open mind and heart when we're talking about these issues, because like you say, they get extremely difficult to hear over and over and over again. And I'm glad that you mentioned that there's lots of joy. There is joy also, but there are definitely things that we need to do better.
So here's a story, a recent story. Even though all over our website it says free of cost to, you know, qualified families, I do all the intakes for now, and it's a lot of intakes, but I have to make room in my schedule, and so that's how I know all these families. And I remember doing her intake, and a few visits in with her BirthKeeper, she asked Devi, one of my BirthKeepers, she said, this is all really wonderful, but I forgot to ask Vanessa, how much do these services cost? And you know, she was surprised. No, this is fun. No, this is what we deserve. We got this funding. You do not have to pay. We're grateful to have lots of different funding sources. King County, a city of Seattle, and other private donations. And that's how we can serve as many people as we do. So that's one of those things that, you know, you can hire a doula, certainly. And there are many families we serve who can afford one. And we never say no to donations. But they want an Indigenous doula. They want to work with someone who understands where they come from. you know, salmon is expensive. Bison is expensive. We want to make sure that they get that traditional foods, especially postpartum. One of the dreamiest births I've been, and I don't attend as many births as I used to, serving a Filipino family, and it was at home, and this was actually her second birth with me specifically, and her first birth, we were actually no, this is her second birth, and so she was laboring around with her husband, um, and she must have been in active labor, not quite transition. And she wanted, we had planned for me to cook arroz caldo, which is a traditional chicken soup. And so there, if you can imagine, I'm in the kitchen slicing the ginger, with the midwife looking over because she was hungry too. And the smells in the house, right? And I could hear them walking around, and I could hear his words, talking to her. It was the dreamiest birth ever, because there I was caring for them like an auntie would. Um, and I hold on to that. And that was, that was a great birth. Um, I'll do another one. One of,
Excuse me, Vanessa?
Right, let me throw one of these questions in, and then
yes, yes.
Allison, because they're coming. So one is about Medicaid.
Yeah.
Is your organization covered by Medicaid? And the ask was, is that going to make a difference to how you serve?
So Washington State, there is a bill that is in process. We call it the Doulas for All Coalition, and it's been approved, and now it's just in the how to implement stage. Once it does get implemented, which probably won't start till after 2025, this has been like a 3-year process, as you might know. We will absolutely, charge for Medicaid to get served. I would say about, I don't know, 70% of the families we serve would have the Medicaid reimbursement. And we would take whatever the state gave us, because like I said, we have the privilege of having other sources of income, of funding, that we don't need to rely on the Medicaid payment. I think it's important to have a bill, though, because I'm thinking about the other BIPOC birth workers out there who oftentimes say yes to births and be underpaid for that work, right? Our labor is priceless, and it is unfair and unjust to keep doing that work being underpaid. And I tell my team how, well, actually my team, they do understand that having the backup that we do for each other, the team backs each other up. I'm, primary, secondary support. We have other birth keepers in our org, and there are additional layers of support. And you might not have that as a private practice, but yes, it won't affect us, but it will affect lots of private practice, particularly BIPOC birth keepers in our area in the state of Washington.
Allison, you have another one?
We have several questions. Let's see, the second question that came in, let's see how to organize these. This might be out of your scope. Is there an agency in Atlanta, Georgia that can help a Native American mom who needs postpartum help for 6-week-old twins?
I can't answer that.
If Dr. Bug can.
Yeah, that's
Well,
what just thinking.
I'm just saying that I don't know of a Native American serving, like Hummingbird. However, there are many of us that are available there are many doulas, full spectrum doulas around that would definitely care for her. So please let us know, and we will definitely send out a word and be able to contact them.
And Kimberly, if you could please drop your contact information then in the chat so that someone can let you know, that would be great. Another question, acknowledging one cannot speak for all or many, what do Indigenous birth keepers need from other perinatal professionals or birth workers that are not Indigenous?
Oh, that's a great question. One of the things I actually recently spoke to residents at this one local clinic, and they asked that question. Some folks were Indigenous, and many of them were not. This was a local tribal health clinic, and they asked me that question. One of the things that I just thought about is oftentimes we're told we're too fat, we're too poor, we're bad parents, right? And that fat phobia that I'm speaking to is real. And what I wonder is when you have that external monitoring, right? Oftentimes that external monitoring doesn't read well, moving around, and so people are stuck in bed. So what happens when people are stuck in bed, right? Many of you know, not great outcomes. And so thinking about what that external monitoring does to the mobility of that laboring person and being mindful of how that would affect them, that is definitely something to consider and discuss with your team. Another suggestion is, traditional practices, right? One of my team members, one of their specialties is aromatherapy. And so they do, one of their visits, they talk about smells that remind them of home. I understand, smudging in rooms is generally not allowed because it's a fire hazard, but just having those herbs around, having those scents, having the altar of your relatives, right? Those things, they're culturally relevant, right? Birth is sacred, and how can you help foster that? And not only foster it, but highlight it so that it's not just a thing that we're requesting because, we need it and we're special. No, this is a bar that should be set for everyone. I'm sure a lot of people on this panel who's here, they probably have lots of other suggestions because they've experienced it with their families. Traditional foods, yeah, those kinds of things in a hospital setting.
Ready for another one?
Yes.
Really simple. I am kidding. I am interested in starting services here on my reservation. How do I start?
Oh gosh, I want to get you all the funding. That's where you start. I'd love to talk to you. There are budding programs. There's a great collective in Alaska. There's wonderful groups out in Eastern Washington, and lots of groups all over Turtle Island. So I will, someone can post my email there. We love talking to folks who want to start, and all I can share is how we did, right? It's not a blueprint for everyone, but it's our blueprint. And but yeah, funding is the most important thing. What is important for Hummingbird is right away, we knew we wanted to pay our staff a salary, right? Because a salary means whether we have a full caseload or not a very big caseload, it's a guaranteed income. But I'll tell you what, we never have a non-full caseload. We are always at capacity. But we also pay really well. Do you want to know how much I pay my staff? No. But it's incredible because we value our work. If you want to know, you can send me an email. But yeah, you know what you need to start is a mission, a community forum to check in with what does your community want, what does your community need, and find that funding.
And I just want to say, there will be a community chat when we have the time, when we can get it set up. She will be with us for an hour just to have a conversation. So those are the type of things that may need to, be chatted about more on a coupled of us conversation.
Sydney, it looks like you raised your hand. Go ahead and unmute and speak up.
Yes, hello and hi Vanessa. Thank you for all you've shared and the work that you're doing. And just for this presentation today, I'm from Ivy Black Girl. We're a community-based organization in Nebraska. And my question is similar to the last question, but as a Black focused organization, we've made a lot of strides as far as training doulas and implementing them, or kind of getting them into the community and to work with families. And so what would be your thoughts about engaging the Indigenous community in relationship, and maybe I don't know how to say this, but we don't have any with the relationships that we currently have. We have I believe 4 tribal entities in our state, but they don't have any doulas that are really operating within those communities. And so just looking for insight about engaging and building relationship, and kind of thinking about how to, share the wealth and extend, some of what we've been able to do with the communities in our state.
Yeah, thank you for that question. And I honestly think that being of the community we serve is one of our biggest why we're so successful. And all you need is one Native person, somebody in one of those tribal communities who is thinking the exact same thing you're thinking, right? They already have the investment in their community. Because you have to trust, right? Like just as like that family, they're like, is it really free? We don't have to pay for it. You know what I mean? Like, is this legitimate? Someone to let them know, let families know, like, no, we do this because we deserve this. And so I think that's my biggest suggestion, is to foster those relationships first.
Yeah, I really appreciate that, because we're thinking about like building our statewide maternal health task force, and how do we invite those partners to the table, and what is the benefit to them when we're asking them to come. So we're still obviously working through some of those things, but appreciate the information that you've shared.
Thank you for your work.
I think this is a related question, and I hope I will read it with the correct emphasis, but the comment/question is, how do we Black doulas make it easy for Indigenous birth keepers to come up? We did it the hard way, but not in vain. I want to help along the way, but not get in the way.
Oh gosh, I love that. Not get in the way. We came up kind of the hard way too, right? I was just looking at this before we started. I looked at this meditation to center myself, and I'll share what it says. You don't want a seat at the table. The table is full of oppressors. And so we're going to make our own table, right? We're going to actually get rid of the table. We're going to go and hang out at the beach somewhere and talk. I think, I'm thinking of the local Black-centered community orgs. We call them our sister orgs, right? And one of them just started, they were private practice for a long time. They got this public funding, and now they're basically doing what we do. They do a little bit differently. And so, and I know, I already know this person in community, and we had a big conversation about how they can get started. So I gave her all of our forms. I gave her our intake forms. I gave her our case note form, how we do birth reflection, how we collect data. I gave her all of it. So, you know, whether she uses it just the same or tweaks it for her organization, yeah, we want to, yes, Table Upside Down is a platform. Yep. So that's one way we, you know, kind of bring each other up. And again, I don't speak for all Indigenous people. You don't speak for all, you know, all Black people. But it's all about the relationship and the buy-in. Both our rates, you know, are awful. So how do we help each other? I hope I answered that question. Oh, I have another way. So oftentimes what we do in this nonprofit world, we hear about a funder. We tell everybody about this funder. We tell everybody about this grant opportunity, right? And we all apply. Sometimes we apply as a collective. It's not about the competition. It's about how we share that money that's out there, even though it's not enough.
You are getting love in the chat, but there are no new questions.
There are no new questions?
Mm-hmm.
Oh, goodness. Okay. Well,
People are too much in awe of you.
I don't know about that.
Say thank you so much, Vanessa. The work that you all are doing is absolutely phenomenal. And also, just, you know, some of the other questions that, you know, we can work on too when we do our community chat is the fact that the other folks that do work with Vanessa have traveled all over the world working specifically with Indigenous people, training on lactation consulting. So I'm sure that, you know, they have connected with you know, communities all over this country for sure. And so again, if there is some connections that you truly want to make, and it's about relationships, and they can definitely give you some ideas of who to reach out to in Nebraska, in Georgia, in the places where you are. And so those are some of the things that we can chat about too, and how to reach out respectfully.
And I
Fantastic.
also, what's
Go
that?
ahead. No, I was
Oh,
saying that's fantastic. Go ahead.
I also wanted to say, if I get a slew of emails after this webinar, we are hiring an administrative assistant for me to help me through those. And so it might take a few weeks, but they will start in a couple of weeks. So I'm very excited.
And just reply, come to community chat.
Oh, there you go. Thank you. That's a good one.
So we'll get that scheduled as soon as possible. Well, thank you. Thank you all for coming